Scenario 1. Lillie, a new RN, is having trouble working with an elderly patient and does not know how to approach the scenario correctly. She comes to a coworker, Heidi, for help since health literacy is a problem in the elderly population. However, Stephanie, another RN, has the evidence-based suggestions to help.
Heidi, I need some help with a patient.
Yeah, what's up?
Okay. I've been busy all day and I have so much going on, but this patient, I was trying to teach her about DVT prophylaxis and using STDs and then teaching her about her medication, about anticoagulant. And she's just not understanding anything I'm saying. She's literally just staring at me like she has no idea what I said. And I'm just really concerned and I just don't know what to do.
Listen, you're a new grad. You got a big caseload today. So I'd say you just leave her. Like, we know what we're looking for with DVT prophylaxis. We know what to look for with all of her anticoagulants. She doesn't get it, that's okay. We can watch out for her. It's not a big deal.
Yeah, maybe, but I don't have time for all this. I'm stressed out.
Yeah, ain't nobody got time for that. We gotta go to lunch. I'm hungry. Let's just leave our patients with Stephanie and get out of here.
Well, no, Lillie, don't listen to Heidi. Heidi's been trying to pass her patients off on me all day.
Gee, thanks, Steph.
But seriously, Heidi, Lillie, you need to spend time with your patient. Go over all the information with her. You know, make sure you check her hearing because she is an elderly patient. That'd be a good thing. And then make sure you check her literacy level using the realm because you never know. She might not understand what you're going over.
Yeah, I mean, that is true, but what about her discharge? Because she's supposed to be discharged today.
Well, make sure all the pamphlets and information you're going to give her relate it back to smog. So make sure she's between the 4th and 6th grade reading level. And then just make sure you ask her, do you really understand what I'm going over? Do you have any questions? Things like that would be really helpful.
What about her medications? Because that's no fun.
Yeah, meds are a tough one, but you need to go over with her, what the med is, what time she should take it, how she should take it, and if there's any precautions with, food or alcohol. Those are stuff charge nurse Kendahl taught me.
Okay, well, you've been such a big help, and those are all great ideas. I think I'm going to go spend some time with my patient educator and definitely make sure all my pamphlets I give her are smog level and take realm in there and just really spend some good time with her. So thanks. And Heidi, I suggest that you take some pointers from Stephanie. She's kind of going places, and you've been here a while, so good luck with that.
Scenario 2. Ms. Lopez is a Spanish-speaking patient who knows only a few words in English. Her nurse, Kendahl, is away at lunch, and Heidi is filling in until she gets back. Heidi decides to go ahead and explain the discharge instructions to Ms. Lopez without knowing her literacy needs since she is a minority. Kendahl comes back from lunch and helps Heidi approach the scenario with the proper evidence-based practice.
Hi, Ms. Lopez. You're all ready for discharge. I'm Heidi. Your nurse Kendahl is at lunch, so I'm going to do your discharge instructions for you. Should be a piece of cake. We'll get you out of here. Okay. So, you shouldn't drive for 24 hours, so make sure you have someone else to come take you home. Remember, you got to keep moving. Move your legs around. If you don't feel comfortable walking, just move your legs. Do some deep breathing. But if you feel like walking is great. It helps you get a lot better faster. So if you can walk, that's good. As far as food, you should take it easy today. Maybe have some soup for dinner or a light sandwich. If you're feeling better after that, you can keep eating your normal diet. If you start getting nauseous after your normal diet, back off it for a little while and then get started again. You should drink lots and lots of fluids. 6 to 8 glasses of water a day is recommended. You can also have Powerade, juice, milk, whatever you like to drink, except for alcohol. No alcohol for 24 hours, okay? If you are having any fever or redness, lots of redness or drainage or bleeding from your incision site, you should call your doctor and let him know, but anything slightly red or swollen is normal. Let's see what else you need to know. Yeah, you should call your doctor for a fever over 100 degrees. No strenuous activity until your next doctor's appointment, which we made the appointment for you. It's in the packet that we're going to send back with you. The address is on there. You can find the location on MapQuest or look at a map or something. So if I can just get you to sign and date this for me, and just put your name right here. Great, thank you. We will get the aide in here and she'll get you out of here in no time. Thanks for choosing our hospital today. Kendahl, you're back from lunch early.
And you're done with Miss Lopez's discharge early.
Well, it was a piece of cake. I just went in and explained it to her. She signed it. We're good to go.
Did the translator come already?
What translator?
You didn't notice she doesn't speak any English?
No, she nodded her head. She signed the paper. I thought she understood everything.
Oh boy. Well, that doesn't mean she understood it. She
No.
is Spanish speaking only, so her nodding her head, she was probably just extremely confused. So, we need to contact the translator, get her to come down, and she's expecting our call. And I will go get the Spanish discharge instructions for her to take home as well. And then how about we'll all go back in together and get this sorted out the right way.
Sounds good.
All
I'll
right.
call the translator.
Great. I'll get the papers. Okay, Heidi, this is Emily. She's one of our Spanish translators here at the hospital, so she's going to come in with us and help us discharge Miss Lopez the right way.
Okay.
Great.
Hola.
Sorry for the confusion earlier, Miss Lopez. This is Emily, one of our Spanish translators. She's going to help us with your discharge instructions.
Hola, señora López. Me llamo Emily. Soy la traductora por el hospital y lo siento muchísimo por la confusión antes.
Ah, sí, okay.
Vamos a cubrir sus instrucciones de despedida del hospital.
Okay.
When you get home today, we want you to just take it easy, just light activities.
Después de su cirugía, hay que relajarse por el resto del día. Puedes caminar en necesidad.
Sí, okay.
Walk as tolerated, but don't do any strenuous activities until after you see your doctor next week.
Es necesario no hacer actividades como ejercicios o correr antes de su visita con su doctor la semana que viene.
Necesito conducir. Necesito que...
She says she needs to drive.
Okay. Well, we can't let you drive home from the hospital today. We need you to contact a family member or a friend to drive you home.
No puedes conducir del hospital hoy, pero mañana sí, hay que buscar un miembro de su familia para conducirte del hospital hasta su casa.
Ah, sí.
Okay. So eat light for the rest of the day, as tolerated.
Por el resto del día, no coma muchísimo comida.
Maybe start with just a light sandwich or even just soup tonight.
Puedes comer un sándwich poquito o algo de sopa para la cena.
Then as you feel better, you can eat more.
Y cuando sientes mejor, puedes comer más, comida más duro, como frutas, verduras, algo así.
Gracias.
And if you start feeling nauseous, then go back to just eating the soup and drinking the liquids until you feel better.
Si sientes náusea, hay que comer solamente líquidos hasta que sientes mejor.
Sí. Okay. Gracias.
Both populations depicted in these scenarios, elderly and limited English proficiency individuals, are on the rise in the United States. These populations are seen in all locations providing health care. Therefore, RNs need to always be prepared to provide appropriate evidence-based care for low health literacy patients.